Hi, my name is Lily and I'm a second year student nurse from Newcastle, and today I'm going to be talking to you about why I think student nurses should be paid for the work they do on placement. Currently, student nurses are expected to complete 2,300 hours of clinical placement throughout their 3 years of their programme. This is part of the standards for pre-registration nurses from the NMC Code of Conduct. So in simple terms, you cannot qualify as a nurse if you have not completed 2,300 hours of clinical placement. The university I attend has a blended approach to learning. You attend placement for 22.5 hours a week and have 2 theory days on campus. Placements usually last between 10 and 12 weeks and cover a range of specialties such as surgery, primary care, elderly medicine, palliative care, and general medicine. Nursing placements are essential as they teach you how to provide safe and effective care for your patients. They also are essential because they help you develop your knowledge and confidence as a practitioner. And it can also help you identify which area you'd like to work in the future. Student nurses currently do not get paid for the work they do on placement, and this has been an ongoing topic of debate for quite some time. However, this hasn't always been the case. In the past, student nurses were given a grant to help fund their study, and there was no tuition fees for university. And more recently, as part of the NMC emergency standards during the COVID pandemic, final year student nurses were given the opportunity to work throughout the pandemic and be paid for this. However, this was cancelled after a few months, the NMC stating that student nurses were no longer required to work. Student nurses should be paid for their time on placement, and this is something I feel quite passionate about, and I'm not the only one. Over 49,000 people signed a petition calling for students to be paid in November 2020. Due to the high amount of people taking part in the petition, the government were required to respond, and they responded with clinical placements provide supervised training for nurses. Student nurses are not paid but receive financial support to train through student loans and non-repayable maintenance grant of £5,000 a year. I think there's a big problem with this statement. I can't help but feel like student nurses are being a bit gaslighted by the government. And I would just like to walk you through the realities of being a student nurse at the moment. Firstly, the nursing bursary we receive does not cover the cost of living. We receive £5,000 a year for each year we study, and although we don't have to pay this back, it's not enough. Private rents in the UK are rising at the fastest rate ever, reaching an average of £969 a month. However, prices in London could drive this figure up. And alongside this, inflation rates are rising, and this dramatically increases the cost of living. Information provided by Newcastle University states that the average cost of living for a student in the UK is £770 a month. Multiply this by the 12 months of the year and you get a total of £9,240. Secondly, the cost of travelling to placement is expensive. One of my placements in first year was an hour drive away. My university expects you to travel up to an hour to get to clinical practice and would look into relocation if it was over this. However, you can claim back travel expenses through the NHS Learning Fund website. However, you do actually have to minus the miles it would take you to travel to university anyway. It's problematic. Courses were moved online due to the pandemic. Therefore, you'd have to minus miles you never travelled. Again, this could leave students out of pocket. Alongside this, sometimes you need to pay for park when you arrive at placement. Some trusts allocate this for free for students, but others you have to pay. Also, you have to pay to study nursing, and this costs approximately £9,250 a year in student fees. Over the 3 years, this totals to £27,750 a year. And although this is paid back via student loans, nurses are expected to pay this gradually. There's also interest that comes alongside this, and in a way, it feels like a debt that we're never going to pay off. Some nurses may also choose to do a master's degree, again, it totaling an extra £9,000. In comparison to another public sector role, such as police officers, If you already have a degree in any subject, you can take an optional 2-year work-based training programme, which you are paid for. Maybe training to be a nurse should adopt this supportive way of training. Also, it's really hard to find time to fit in part-time work when being a student nurse. You have clinical practice to attend, lectures and assignments to carry out. Due to the nature of the job, you're expected to work unpredictable hours such as night shifts, long days, bank holidays and weekends, therefore making it extremely difficult to find routine part-time work alongside this. Alongside these financial pressures, student nurses are also on conventional student ages. Nursing attracts many mature students. Many mature students have mortgages to pay and families to support. Therefore, student nurses should be paid for the work they do in clinical practice. This is concerning as the financial pressures that come with being a student nurse could possibly deter someone who could be a really good nurse. And finally, it's important that we look after our student nurses. Here in England alone, we are experiencing an NHS crisis. There are currently over 40,000 vacancies for nurses within the NHS. The Royal College of Nurses suggests that this could be due to economic factors, such as losing great staff from the European Union, lack of higher pay and increased workloads and stress that comes with the job. Our student nurses are the future of the NHS and we should look after them. To conclude, it's quite demoralising not being paid as a student nurse. Student nurses work really hard as part of an amazing team to provide safe and effective care. Nursing is extremely rewarding, but it's a really hard job. You deal with death, challenging behaviour, physical demand and labour for long hours. This is why I believe student nurses should be paid for the work they do on placement.